there is one mark the COVID-19 pandemic has left on most Canadians, it's a heightened sense of awareness around viruses and bacteria. But a recent study has warnings around the increased use of certain cleaning products that may be doing more harm than good. Researchers point to cleaning products that contain quaternary ammonium compounds, or QACs. Now, these products have been connected to asthma, dermatitis, and even inflammation. QACs can be found in disinfectant wipes and are commonly used in other antimicrobial products that were in high use during the pandemic. Now, according to the study published in the journal Environmental Science and Technology, such products are lacking proper regulation and research. Well, joining us now to talk more on the safety considerations around certain cleaning products in our weekly medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back.
Good evening. Great to be here.
So let's start with unpacking QACs and how they affect the human body.
Right. So now QACs are a very common class of chemicals, and we see them in antimicrobials, preservatives, even softening agents, and of course, disinfecting products, which we saw a massive surge with during the pandemic. We are exposed to these chemicals by inhaling them or touching the disinfected surfaces, or even eating them if food is around when the area is being disinfected. Now, what we do see is these QACs can cause allergic and skin rashes, even with very limited exposure. If you have eye contact, you can cause burning of the eyes, even eye injury and blindness if it's severe contact. And many QACs can actually trigger asthma symptoms as well. So we find people with difficulty breathing or even chronic cough in a QAC full environment.
Some concerning symptoms there, Dr. Raut. Now, we spoke a little bit about short-term exposure, but what are some of the long-term impacts of exposure to QACs?
Right. So now we've seen QACs even in our wastewater, and this is relevant because what we've seen is that in the wastewater, there actually can be toxic to certain kinds of fish. So it really begs the question about long-term human safety as well. And we've already seen an uptake of these respiratory infections or symptoms that are coming in. We're seeing doctors, nurses, housekeeping and cleaning professionals. They're developing more respiratory infections, more COPD disease, and more asthma from this chronic exposure to QACs. But we're also starting to see is some general links to other issues like infertility or even birth defects from potential parents being exposed to QACs. So that's very concerning.
Very concerning connections there, Dr. Raut. Now, considering the impact on adults, just how dangerous could such cleaning products be around children, especially considering disinfectant could be used on children's school desks, especially throughout the pandemic?
Right, exactly right. Right. If you think about a child's classroom, how many items are disinfected with, let's say, cleaning wipes, just almost everything. A child is, of course, more likely to put things in their mouth as well after touching it. So the concern of QACs being more harmful to children is present because one, they're getting a larger dose of it from their environment versus an adult, and two, they're much smaller than adults. So when they're getting that dose, it's at highly more effective concentration of QACs in their body than what we would as adults.
All right, Dr. Raut, a two-pronged question here, but what kind of common cleaning products have QACs been connected to, and how can Canadians identify products with QACs in them?
Right. So I think we see some of the statistics that roughly half of the cleaning products that were spiked during the pandemic definitely had QACs in them as well. And what we're seeing in this as well is that it's very difficult to ascertain what products have QACs. In general, what we should be looking for is chemicals like ammonium chloride or benzalkonium chloride. So anything with that ammonium in there is likely to be a QAC, and you want to stay away from them.
All right, Dr. Raut. So why are such compounds in cleaning products in the first place? Is there no regulatory body that maybe oversees the production of such products?
Honestly, not really. We use QACs in hundreds of industries and in our environment, and most QACs really haven't undergone any rigorous regulatory assessment. So for clinical doctors and public health physicians, this is frustrating to say the least.
Frustrating indeed. Just about a minute left, Dr. Raut. But from the looks of it, QACs can be found nearly everywhere, at home, at the office, hospitals, even in the environment. So how can Canadians stay safe amid all this, especially those exposed to it regularly, as you said, nurses, housekeepers, janitors, etc.?
Right. I think the first thing here is education on this topic. If you're going to go into a classroom or an office, or you're being exposed to chemicals and you're noticing that sensitivity, maybe a rash, maybe more allergic symptoms as well, you should definitely think about QACs. You should let your team lead know that you're having these reactions because you do have rights as a person working there, and certainly advocate for a change in that environment to minimize that QACs. You'll improve your health by advocating and also those around you.
All right, Dr. Raut, thank you again for another informative interview.
Thanks so much for having me.